Okay, I think we're going to go ahead and get started. My name is Maya Barry. I'm the Executive Director of the Arab American Institute. Many of the folks on this call have been longtime supporters of our organization, which was started in 1985 specifically for the civic engagement and political empowerment of roughly 3.7 million Arab Americans. One of the ways that we arrive at the 3.7 million Arab American number is relying on census data. Today, April 1st, is Census Day. These are certainly difficult and trying times for many of us, but for those of us who are engaged in civic engagement work, there's a whole new way to do digital organizing, including our work around the census and our Yellow Vote work. So we thought that it would be helpful to bring our folks together for a quick call. We're going to cover 3 different topics. The first being Yellow Vote, the second being Yellow Count Me In, which is our 2020 Get Out the Count program for the census. And the final is to hear from Dr. Abdul El-Sayed, who I think many of you know, but for those who don't, I think you're welcome. The opportunity to talk with him about this sort of unique moment in our country right now, given his medical background, as well as the fact that he himself is very much engaged in the political process and the importance of making sure we have a healthy democracy in place. So without much delay here, we're going to do that in a quick 30-minute period and then open it up for Q&A. We will be a hard conclusion at 2:45, and I promise to keep us on time. With that, let me turn it over to Ryan Sudo, who is our policy counsel here at the Institute, for his presentation on Yellow Vote and what you can do to help us with regards to Yellow Vote during this time. Ryan?
Thank you, Maya, and thank you everyone for joining. So happy Census Day, as Maya mentioned, but also happy American Heritage Month. Today's the first day of that. So AI's got a lot of stuff with that as well for the rest of the month. So to talk about Yellow Vote quickly, I think we have our slides working. So if we go to our first slide on the AI screen, Almost. As that's loading up, we're going to first, as everyone knows, there have been a lot of delays in the primaries because of the current pandemic. So on your screen, you see the 14 states that have not voted and have moved their primaries. Some of those states are big for the Arab American community, such as New York and Pennsylvania and Ohio. So please, if you're in any of those states, not only check the new dates, but also check if there have been any changes. Some states have moved completely to vote by mail, and those are important changes. Which leads us to the reforms that the Arab American Institute and our coalition partners are advocating for. Next slide. We're advocating for several reforms that are really important. We would think that will mobilize the vote. One being, there you go, online voter registration. We're advocating for early in-person voting, vote by mail, modifications of polling places pursuant to public health guidance, and then active efforts to increase voter education and to combat misinformation. So that's what we were doing on our end. We're doing it always, but especially during an election year. And then our next slides, we're going to talk about what you guys can do to help. Thank you. So relational organizing, it really means that everyone on this call, needs to be an important part of our efforts to really try to get as much voice for the Arab American community as possible. Relational organizing means finding the people in your circles who care about issues but aren't involved, and reaching out to them and get them involved. That's the best way, the most trusted way to say, this is the process that's important, is say, I'm part of it, and I think you should be a part of it as well. A couple ways to do that is, being part of National Voter Registration Day activities that we're going to be hosting out in September, and checking our website for state voter guides, participate in our voter banking. And also, we have a new check your registration widget on our website. So if you go to our main page, you can click through that and make sure that you're registered. And if not, actually register. But also, again, with relational organizing, we need you to also make sure that your friends and family are registered to vote and do vote as well. So all of this is really important to kind of making sure the community's voice is heard through the formal processes of democracy, which in this case is elections, but also will be census. So after the census, you'll hear from Suhair next, talk about the census. All of our partners that we engage with on the census, we're going to be activating them on getting out the vote as soon as the census is wrapped up. So we think this is a good transition. They're both really civically important activities for the community, and we need everyone on this call to be part of that. So with that, I'll turn it over to Suhair.
Thanks, Ryan. Hi, everyone. My name is Suhair Addy. I work at the Arab American Institute, and since 2018, I've been doing all things census at AAI. And on April 1st of 2019, we launched the You'll Count Me In campaign. So hopefully a lot of you are very familiar with that. But in light of what's going on with the coronavirus and everything that's happening, we just wanted to give a few updates to our community to let you know what's going on in terms of census. So first and foremost, the census is still happening. I think everyone needs to be reminded of that. We're currently in the self-response period, which just means that you're responding through, different avenues of filling out your census form, but that ends in early May. By the second week of April, if you haven't already received a paper form, you should be getting it. That has not changed since we first announced that. And you do not have to fill out your form more than once, meaning if you get a paper form and you already filled it out online or by the phone option, you can just stay tight and you will be good to go. You can access the form in 13 languages, including Arabic and English, if you choose to respond online and by the phone options. So all those things remain true, and those are all resources that we want you to be aware of. However, there have been some things that have been extended or have been put on hold just in light of what's going on and to maintain people's safety. So census hiring and field operations have been delayed until April 15th. With the new federal guidelines that have come out from the White House stating that we're supposed to be social distancing until April 30th, that's likely going to be extended to that April 30th date, though the Bureau has not announced it yet, so we don't want to preempt that and say anything in advance, but just letting people know. That basically means that paper forms that are coming in are still being counted. A lot of people have been wondering about that. But survey-based enumeration, so think homeless shelters, soup kitchens, things like that, will be delayed in terms of counting. It will still happen. They still will be counted. It just means they won't be counted in the times the Bureau has said that they would be counting them. Hiring delays have been happening just due to the fact that people can't go get their background checks or fingerprinting and other things done. So just logistical. And the non-response follow-up, because of the hiring delays, will be postponed as well until early May. It was supposed to start in mid-April. The one thing we want to remain that let everyone know is you can still respond, and so we should still be pushing people to respond to their census forms regardless of these delays that are happening, because the census is still going to be done on August 14th, so that it has not changed. The response rates from 2010 were at 3% a day coming in. We're coming in at 2% a day now in 2020, so we know we have our work cut out for us, but that's where everybody here on this call comes in. Next slide. So there are 3 ways to complete your census forms, like I talked briefly about. There's the online response portal. You can do that by going to my2020census.gov. You should have received a letter by now that gives you that information, and you have a unique ID that you can put in. If you haven't received a letter for some reason, you can still go to that website and still fill it out online and just choose I don't have an ID and just input your address and go through the process. You can also access the online portal by computer, tablet, or smartphone, so there's no reason why people cannot be doing it, and something that we really want to emphasize is the different ways they can be responding. You can respond by phone and by the online form, again in Arabic, so that's something we want to push for people that you know in your network who are not native English speakers or might need the language assistance. They have the opportunity to have that by the online and phone options for the first time ever. The paper option is going to be coming, like we said, in the second week of April. You can access a language assistance guide in Arabic. However, it'll only be in English and in Spanish. Next slide. So what will the census ask you? We say it's 10 questions, it only takes 10 minutes, but the data impacts our community for 10 years, and that's something we really don't want to miss out on. So There are general questions that it asks around age, race and Hispanic origin, relationship status of the people who live within the household, home ownership, do you rent or own the property that you're in, the telephone number, and then just age and date of birth for the people of everyone who's living in that household. However, the census does not ask, and it's really important that we emphasize this, social security number, citizenship status. It does not have a meaning category, doesn't ask about religion, doesn't ask your political party or bank or credit card information. And in fact, if you do get something that says it's a census form with any of those questions on it, you can completely disregard it or send it to us so that we know that other people are not being impacted by the same disinformation that's happening around scams or things like that. Next slide. So how do you fill out your census? So this is what the paper form looks like, but if you go to the next slide, the online form, which is what they're pushing everyone to use, and which will be a helpful resource, I think, in the times like these where people are going to be home and potentially have more access to internet than they would originally. You can fill it out by going online. Like I said before, you've had the first question, which is Hispanic origin. This just shows you that you can click more than one of those boxes and give that information. So just to be as granular as possible with the data. But the race question gives you the different options to check off different racial categories. You can check off whichever racial categories you feel like that you identify with, and then write in your family's ethnic origin. But the key here is that you write in your family's ethnic origin, because that is how we are able to go in to get the data on the Arab American community. We add up all those different Arab American countries and just get the final number so we're able to do the work and inform the work that we're able to do. Next slide. So what can you do? Ryan talked about relational organizing a bit, so I won't go through that again, but I do want to say that when the census is something that is unlike voting in the sense that it comes to your door. We haven't perfected that with voting yet, hopefully in the future, but in light of what we have here, we can just really emphasize the fact that you can just check your mail and you'll be getting a census form. And in the times like this, when we're having conversations with family members or people just checking in on you or you're checking in on them, it's easy to just ask like, oh, have you checked the mail lately? Have you got that form from the Census Bureau? Have you filled it out? And just putting it into general organic conversations is going to be key to getting out the count when we're all working remote. The second thing is census phone banking. Just similar to what Ryan said before, we're going to be doing remote phone banking sessions, so stay tuned for that, and we'll be giving them out to the list that you all hopefully heard about this call on. We're also going to be able to use your own list to do that currently. So you can take your cell phone out, or you can take your book out of like different phone numbers and call people that you have in your network and just ask them, have you filled out your census form, and go through your list. It's a good way to spend some time when we're all bored and not wondering what we could be doing. But this is a helpful way to be engaged and do what we can with the people that we know the best. You can also direct people to our Yola Count Me In hotline. So it's 833-IDUNI, which is in Arabic, count me in. So we can get people to call that hotline to be able to provide different information and resources that they need. The last thing is you can share on social media. So whether it's Facebook, Twitter, or Instagram, or even WhatsApp, you can be able to share different Yola Count Me In resources on social media for people to use and to learn about what the different parts of the census mean or how they can be sure that they're accurately counted, which is, like our different fact sheets to just information about privacy and data privacy concerns or so on and so forth. We have those that are easily accessible for everyone. We also have a Twitter storm today at 4 p.m. Eastern. So please, please, please join us online, just using the hashtag Yola Count Me In so we can see your content and be able to share it and amplify it even more. We want people to know about the campaign, but really we want people to know that they should be counted and it should be counted accurately, because that's our most important goal here of this campaign. You can also follow Yola Count Me In and AAI USA for more social media campaign ads and different ideas and things. We created a new video that came out today that's about race and ethnicity that I think is really fun. So hopefully people can be engaged in those different ways. Next slide. And lastly is yolacountmein.org. So hopefully after this, you think to go online and see what we have to offer if you haven't already done so. But we have an online pledge and an interactive map. And I think the interactive map has information per state about Arab Americans in each state. It also talks about who our partners are locally, so you can get involved with them as well. We also have downloadable resources. So when I talked about sharing content, you can go onto our website and download that content to share out. And we also have a toolkit that has sample content in it that's also on our homepage, so you can be able to go check that out. And with that, I'll pass it back to Maya.
Thank you so much, Suhair, and thank you, Ryan. Yalla Vote and our Yalla Count Me In campaigns are foundational programming for us, and we really appreciate all the work that's gone into them. And I want to remind you that what Suhair and Ryan both talked about is this warm networking. Basically, it has to be folks that are directly connected to you. So I need two things before I turn it over to Abdul. One is that because we're basically going to be calling and emailing you, we really do hope that you're able to engage with us, respond to those emails, take the actions that we are asking you to do, and then to do the relational organizing with your own context. People are likely to listen to those they know in ways that are different. So as our family grows during this organizing process, we really have to rely on you to assist with that. So we are totally on time, which is a wonderful thing. Abdul, are you with us? So I think we have Abdul online.
Can you hear me okay?
Excellent. Wonderful. Okay. Before I turn it over to you, I think that we would be, right now the screen is showing, Abdul, your new book. I don't know if you can see it. It literally just came out, I think, yesterday, called Healing Politics. Abdul is uniquely qualified to talk to us right now during this period for a variety of reasons. One of them being that he himself is a physician, an epidemiologist, which I can never pronounce, but he's also someone who garnered more than 340,000 votes when he ran for Michigan governor in 2018. You know, it is in our DNA to encourage Arab Americans to run for office, from their local city councils to the presidency on. So we were excited to have his candidacy at that time, and frankly excited to have his voice now on these issues. We see him regularly on CNN, and we're proud to have an Arab American provide that kind of commentary. But I also think that your experience as a health commissioner in Detroit, Abdul, can also help us kind of, one, ground the conversation that we need to have today, and to perhaps also provide some hopefulness about how we do the continued political work that has to happen. So with that, let me turn it over to you. Abdul will make his remarks, and then we'll have an opportunity for some questions and answers.
Yeah, absolutely. Maya, thank you so much for a generous introduction, for inviting me to share some space with you all today. I'm really grateful for the work that the Arab American Institute does. We stand on the shoulders of giants. And if you think about folks who have seeded the space for Arab American civic engagement, everywhere from the grassroots to folks running for high office, you see the fingerprint of the organization. So really grateful to you for your work and your effort. Grateful to all of you who've taking the time to join us. Although I do believe that if you're like me, you probably have a little bit less to do on your hands. And so grateful that we can make some good use of the time. I want to just speak to this moment right now, and then speak to what it means for our civic engagement moving forward, both in terms of the responsibility to engage and the work that has to be done. I don't have to tell you that we are facing what is probably the greatest disruption in American life since, I would say, probably World War II. And even then, the degree to which this virus has stopped us all in our tracks and put our country's most vulnerable in positions where they are forced between doing what it takes to help us save lives and socially distancing versus going out and trying to make a living and save a livelihood is a moment to just reflect upon and how somber it is, because this moment is manufactured. It's not. I don't want folks to think that a pandemic is just like a hurricane, that it just happens, that a hurricane comes blowing through and then there's nothing really you can do about it except for head for the hills or seek shelter. That's not how pandemics work. Pandemics are imminently preventable. We should be able to prevent them, and the fact that we have not prevented them says a lot about both our country's disinvestment in public and civic infrastructure, and then second, the kind of system that we've built that leaves so many on the slippery edge of economic viability and civic participation. And so, as we think about what the responsibility we have looks like in this moment, I do hope that we realize that this moment frames a lot of the work that needs to be done. Why is it that we had fundamentally disinvested from public health. And it's not just the administration. It's the fact that public health funding over the past 15 years has dropped by about 45% at the state and local level. Why is it that we're okay with the fact that the CDC keeps getting its funding proposed to be cut? Why is it that the state of our international politics is such that we can't work with our partners in other countries to coordinate an international response? These are all questions that we have to be asking in this moment because this moment has brought them to light. And so I want us realizing that this moment was preventable, that the consequences of a pandemic were preventable, and that the work we have to do has to be framed around preventing such things from happening in the first place, and then doing the work to make sure that if and when they do happen, that people are protected and they're not vulnerable to exploitation because of the circumstances in which we've put them as a society. So this is how I'm thinking about this moment. Now, I want to speak to why our community is so uniquely critical here. Like every other community, we're affected, but I actually also think it's critical to appreciate that actually we're disproportionately affected. You know, whenever public health fails, the people who tend to be hurt the most tend to be the folks who are most marginalized in the moment anyway. And our community has been the receptacle of a certain kind of politics for a very long time. And a lot of folks in our community may be socioeconomically empowered, but a lot of folks are not. And you talk to the small business owners in communities like Dearborn, you talk to the folks who are working gigs or working hourly wages, and they're being devastated by this, forced to stay home, worried about whether or not they're going to be able to put a meal on the table for their families. And so this affects our community, but it also reminds us that we have a role to play in terms of advocating for the kind of country where everybody belongs. You know, what it means to be a truly inclusive place that does invest in the morals behind the ideals. We hold these truths to be self-evident that all people are created equal. What does that mean in the context of a pandemic? And what does that mean in terms of the work that we need to do after the pandemic? And then the last point I'll make is that for a lot of us, right, if you're able to join this call at 2:26 in the afternoon on, I don't even know what day it is, a Wednesday, that means that you have the time to be putting into the work coming out of this. And we will get through this. This will pass. It'll pass after a lot of pain and a lot of hardship for a lot of people, but it will pass. And the question that we ought to be thinking about, which we're rightly here to do, is how do we come together to empower our community to do the work of building the kind of America where this kind of thing doesn't happen again, where we have the public health infrastructure, the public infrastructure available, the kind of leadership that we need to respond to a pandemic like this, and put it out when it's small rather than fight it when it's big. And do we build the kind of America that's just enough and equitable enough and sustainable enough that nobody finds themselves on the slippery edge of viability if and when something like this is going to happen? And then the last point I'll make is that, you know, it was a pandemic this time, but the next time it might be a climate event. And all of this goes to an ethos that we've been taught not to invest in, which is the notion that actually we should start to solve long-range problems early rather than wait until when they hit us and then try and respond to them thereafter. And so, you know, this time it was a pandemic, next time it might be a climate event. Either way, we have a responsibility to do what we can to protect ourselves from it and to engage on issues that take our full collective and our full focus, working with folks from other communities to build the kind of America that truly does dignify all of us. I think that work takes a number of forms. It takes just the local organizing that puts these issues in very concrete and very local terms. You know, sometimes we talk about abstracts, and abstracts are hard to get behind, but concrete local terms, working within our community to talk to folks about exactly what the implications of this were for them and what the alternative could have been, working with them to be able to make those cases about why they need to get involved and why they need to be empowered and why they need to protect themselves in the future. It also means being able to engage with other partners who are doing this work. So beyond just engaging within our own Arab American community, thinking about who other communities are that have been disproportionately affected and are leading on this issue, and how we build partnerships around shared interest in opportunity in this moment. And then the last thing I'll say is that just like Suhair talked about, making sure that we're counted both in the census and then also in the ballot box. And we've got a moment right now that is uniquely important in the context of this to make sure that our voices are heard. For the next 10 years, this census is going to set the stage for how people think about our community. And it's absolutely critical that every single person knows how to fill it out and feels empowered to do that. And then, we've got a presidential election, and I know that you all are 501c3, so I'm just going to say that that justice and peace and sustainability, they are all on the ballot in 2020. And I know where our community sits, and we better make sure that our folks are empowered to come out. The opportunities are there if we're willing to embrace them. And I know that oftentimes in our community, there is a reticence about being involved in an explicit way, but politics is not something that you just experience as it happens to you. Politics is something that you experience as you do it. And I do hope that, our race and so many others, both at the local level and at the congressional level, have shown people that you can be active participants in your politics, and good things can come of it. And so I do hope that this is a moment for us to leverage this unique experience, this tragic experience, to get folks involved, to say, look, forget all of the politics that we're so used to talking about abroad, but let's just ask ourselves how we got here and how we get out, and what we're willing to do to come together, both as an Arab American community and with folks from other communities, to make sure it never happens again. And I think that kind of organizing, the brass tacks on the ground, local organizing, that's about building partnerships inside a community and outside a community. That's what it's going to take right now to embrace our voice and to build the kind of future that protects all of us.
Thank you so much for that, Abdul. We really appreciate it. A reminder to folks that if you have questions, to please use the chat box to ask those questions. Abdul, if I may start with a question regarding how census data impacts both our local healthcare systems, our hospitals. This is an issue of urgency now, but to perhaps connect those for us to better understand it.
Yeah. So I actually started my career studying Arab American health. And I remember writing a literature review. I want to say it came out in 2009 about Arab American health. And there weren't that many studies that met our review criteria. And part of the reason why is because if you want to count stuff and you want to understand disproportionate burden, you need a denominator. It's one thing to say there are this many cases of heart disease, there are this many cases of infant mortality, but among whom? Among how many? And without that data, it's nearly impossible to get a great sense of, what are the health challenges that we face and where should we be focusing our public health and healthcare efforts to try and address them. And so the census is where we usually get that data. And we know for so many reasons that census data, especially when it comes to our community, is imperfect. And frankly, even coming out of this census, for all the reasons that Suhair had to explain, it's still going to be imperfect because for some reason or another, we're still considered white people. And I've never been treated like a white person my whole life. I don't want to be treated like one when people are counting my data. So we need to show up for this census, because part of the argument that we're going to have to make again in 2030 is look how many folks are going uncounted and who we can't explicitly identify simply because there is no category. And insofar as you don't count us, we are unseen. And insofar as we are unseen, the consequences of mistreatment go unheard. And so I can't emphasize enough just how important it is that we get our communities counted, that we make a case for our own existence as a community. And that starts with showing up for the census right now.
Yeah, this is a good opportunity for us to share that when Abdul is talking about not having a category of our own, we came very close to having a category called MENA, which is Middle East and North Africa, added on the 2020 census. And regrettably, this effort was abandoned by the Trump administration. So now our Get Out the Count campaign has to both educate our community that the box is not on the 2020 census, but at the same time, you have the opportunity to check, as Suhair mentioned, any race that you identify, and then make sure you write in your ethnicity. But But for folks to know that our efforts are not abandoned in terms of the MENA category, we actually sued the Office of Management and Budget to find out why the category was abandoned, and we're continuing that suit moving forward and will not abandon efforts to secure it for the 2030 census. In fact, they'll start immediately after the period wraps up, which was going to be July 31st and is now August 14th. So for us, August 15th, we start in 2030 and our efforts to resume the MENA category. There's a statement that was made about making sure that the slideshow is available to folks, and we will certainly do that so that you can share that information, no problem at all. Let me ask you, Abdul, when you talk about the kind of work that has to go and happen on the local level to keep people engaged right now, when we really are dealing with some pretty urgent, immediate needs for families and individuals, what's the conversation like in Detroit right now, given that regrettably we're seeing the surge in cases? And two, how is the civic engagement and political conversation, or the democracy conversation, happening for you at this time?
Yeah. So I want to step back and just appreciate the fact that, if this were happening 30 years ago or even 20 years ago, our capacity to share a conversation would be so much more limited. The fact that we can see each other's faces on a screen in real time and communicate ideas just fundamentally changes the game. And so I want to just say that I appreciate that, because the point I'm trying to make is that we need to use that. You're seeing a lot of conversation about where we are now and what we do now. And to be quite frank, as a public health doctor, it's most of the conversation I've been having. This is how you keep yourself safe. This is what's happening right now. This is what you can expect. Not as much conversation about what's going to happen next. And this is actually a space where I think organizers need to start moving, because I think we're starting to saturate the message about where we are and where we're headed. At the same time, though, there's still so much misinformation out there and misunderstanding of what safety means, why we're social distancing, what the responsibility for everyday folks looks like. So while we're talking about this, we also need to start moving the conversation to say, how do we get here? There's also this conversation that's happening, and it's very expected, but also very disingenuous, which is to say, when you talk about the politics that drove a public health disaster, people say that you're politicizing the disaster. And the worst politicization we see every day are these news conferences that the administration holds, which is driven mainly by a political message rather than a scientific one. And yet, if you respond to that, people will say, well, you're politicizing the disaster, as if there's some real information being moved by a certain individual. And so I think there's a balance that people have a responsibility to strike, which is to say, we need to be making sure that people are doing what it takes to keep themselves and their families safe right now. And what that means is really pushing the public health message right now. And at the same time, we also have to have a parallel connected conversation about what we will do after this to make sure that we're protecting people, not just right now, but in the future from something like this ever happening. And that means embracing the politics of this moment. I've long believed, I wouldn't be doing the work I did, I've long believed that public health is political. Politics is just, lowercase p politics is just a discussion about how we allocate scarce resources in society. And when we make decisions to move those scarce resources away from building public health infrastructure and away from science, that is a political decision. And it has huge implications for people's health. So public health is political. There's no way around it. And anybody who tells you that you're politicizing public health is themselves politicizing public health, because they don't want to have the hard conversation about why their actions with respect to our scarce resources have now made people very, very sick. And so I think we have to respect the responsibility to move honest technical information to people about how best to keep themselves and their family safe, and also have a conversation in parallel about how we frame this moment to best articulate why this happened and what we can do to make sure that it doesn't happen. And having those two conversations is hard to balance. Trust me, I try and do it every day, and it's not an easy thing. But these are both conversations that need to happen at the same time, because if we get either of them wrong, we are potentially hurting people. And And I think that we have to respect that and appreciate that, because the public health at its core is about prevention. And unfortunately, it's too late to prevent. Like, what we're doing right now is responding. And yes, the response will prevent other people from getting sick, but we should have been playing well ahead of this before this ever happened. And we made decisions that left us vulnerable to this. Now it's time for us to do the work of prevention to make sure that coming out of this, we do what it takes to make sure that something like this doesn't happen.
Abdul, one of the questions that was asked is that we're talking about snail mail for voting. We're talking about responding to the census in terms of your mail-in option, but people have a concern about COVID-19 and using mail. Can you speak a bit to that?
Yeah, as far as we know, the survivability of this virus on porous materials, so things like cardboard or paper, is less than 24 hours. And so these are the safest ways to participate, barring, of course, online engagement, which, for a lot of reasons is the technology is just not there to keep it safe when it comes to voting. And so I think, folks can feel safe checking the mail. And if you really wanted to feel extra safe, maybe you could make an argument for getting your mail a day after it was left in the mailbox, right? And that way you just say, well, we know the survivability of the virus is near 24 hours. So if they drop off the mail at 2 o'clock every day, I'll go pick it up at 1 o'clock the next day. But it's a safe way to work and exchange information. And so I don't think people should worry too much about the potential to expose themselves through the mail. The key thing is stay home. I hear oftentimes perfectly reasonable people talking about, I went out to do X, Y, or Z thing, but I'm really worried about the mail. And I'm like, well, the real danger here isn't the mail. The real danger is you went out for an unnecessary reason. So stay home, maybe keep your mail in the mailbox for an extra day, and you should be just fine.
We have a question about filling out the form and not necessarily checking white, specifically in reference to government surveillance, which is I think, correctly pointed out, is not an unfounded fear. So the question is, how do we reassure our elders in our community who feel like white is a category that will cause less problems, quote unquote? So here, if I can have you speak real quick to messaging that we did about the concerns regarding surveillance, and then your advice, Abdul, after.
Yeah, so I think a lot of people had been, rightfully concerned about the surveillance piece and about what will happen if people fill out their census forms. However, it was interesting. I think newer communities said that they were less likely to be concerned about filling out their census forms. And typically it's people who've been in the United States for a really long time that feel a bit more apprehension with filling out their form. Probably because people who have recently immigrated have already given what feels like all their information to the government, so they have a less of concern around that. But what I will say is, for census data, it's the most protected data in all of the US government. It's bound by Title 13, which is a lifelong oath that census workers have to take. So that's something that we really encourage people saying and letting people know about, and knowing that if they violate the oath, they're subject to 5 years in prison and a $250,000 fine, even if they still don't currently work at the Census Bureau and they violate that oath. So just as a general way of kind of sending it out there, I think those are the ways that we've talked about data privacy.
Thank you, Suhair. Abdul?
Yeah, I'll say that there's a couple of pieces that I'll just echo. One is that also people have a sort of, I think there's a collective PTSD from folks who lived through 9/11 and post 9/11. And I want to speak to that for a second, because there was a very different data environment during 9/11 than there is now. And, the reason that I think a lot of folks were so astounded by, the frank violations of civil liberties was because it was a very different time. We didn't actually give our data out all that much, because all of it had to be done on paper, because that was 2001. The way that data is used now, and the degree to which people have data on us now, simply by virtue of like doing what we're doing right now, of having every account through every social media platform, through Google, through Gmail, through everything, right? Is that we just give out way more data in so many more instances. Yes, to corporations and not the government, but also, given what we know about the relationship between corporations and government, that data is not that hard to access by government. And so my point is not to say that that's okay, right? I don't think it's okay that anybody take people's data, and I don't think we should be giving out as much data as we ultimately do. And I do think it's really important for us to push on protections for civil liberties from that data. But that's also to say that if you're afraid of being able to click white versus Arab American, or put your ethnic background on the census form, they already know that about you, right? It's already out there, and there's almost no way that it's not. And so when you think about what you actually say in the census, it's so minimal relative to what is already out there about you, just based on your social media platforms, just based on your use of email. Like if you've ever transacted anything online, that's all out there already. And so the relative fear that people should have about clicking that in the census is just so much lower than what's already out there on the internet. And so all of that is to say that, like, let's not sell short the fear of what people can do to use your data. But let's also not pretend like the census is the biggest the biggest deployment of data out there. There's a lot more that's shared all the time, just simply by being and doing on the internet. And so, if folks are afraid, the right place to look is like, well, should I be doing as much as I'm doing on the internet, rather than saying, should I be giving them my information about how my self-identified ethnicity looks on a census form?
Before I go to closing remarks, I just wanted to offer that one of the questions is asking as to why the Institute pursues a MENA category, Middle East and North Africa. And I think it's important to clarify for folks at this time that MENA is a geographical category. It is not an identity. We're not asking people to become MENA Americans. It's simply our way of gathering information about the 22 members of the Arab League, which would be included in MENA, as well as the 3 additional countries of Iran, Turkey, and Israel. But for our purposes, MENA was exclusively about having a geographical category, and then within that, you would then identify your own ethnicity. That allows us to go in, when Abdul was talking about a denominator, we believe there's a prevalence of diabetes in the Arab American community. We don't know what that actual number is because we don't have good data to determine what that denominator is. That's what the census data allows us to do when we're able to count you as Arab Americans. We simply go in and pull the information on all who checked off Palestinian or Egyptian or Syrian, Sudanese, Lebanese, all of that. We gather that up, and that's how we get to our 3.7 million number. As we get ready to wrap up, Abdul, if I can just ask you, one of the questions was sort of how you envision our healthcare looking forward. And I know that you wrote a whole book about the humanity of that piece of it. So to speak to that a bit, and then I'm going to ask Ryan and Suhair if they have anything to offer as we close. But Abdul, why don't you go first?
Yeah. I think anybody who knows me knows that I'm a big advocate for Medicare for All. The book that's coming out after this one next February is a Citizen's Guide to Medicare for All. I think we have to deal with the fact that our healthcare system right now has 4 fundamental faults. Number one, 10% of Americans aren't covered, and for 50% of Americans who are covered, their healthcare still sits behind a paywall. Because they have to pay down a deductible. Kaiser Family Foundation, who's a pretty big public health think tank, they calculate this deductible relief day, which is the day on which the average American pays down their deductible. That's May 19th right now, and it's getting later and later. That means right now, in the middle of this pandemic, most people haven't paid down their deductible, meaning that their healthcare is behind a paywall. So that's problem number one. Problem number two is that relying on profit margins to keep hospitals afloat is extremely dangerous. And we're seeing why right now, because most hospitals make their money on elective procedures. And what do you do when you're trying to prepare for a major pandemic? Well, the first thing you do is cancel elective procedures, which means that you just basically cut off your supply line of money. That leaves you extremely at risk for bankruptcy. So you're battling bankruptcy and also a COVID pandemic. Bad news. Third problem is that, the way we supply is based on, traditional business consulting, which says that you shouldn't keep any supply and overhead on you. You should always use just-in-time supply. And now, while we're battling this COVID pandemic and we're asking where's all the personal protective equipment and where are the ventilators, we're realizing that just-in-time supply, when it comes to life or death, is probably not a great thing, because in the middle of the pandemic, nobody gets supplied. And that's where we are right now. And then fourth is that in a system that's predicated on providing people care after they get sick, there is very little incentive to keeping people healthy. And you ask why we only spend 3% of our entire healthcare budget on prevention, and why our public health infrastructure has been shown to be so weak. Well, it's because there's no incentive to prevent. There's every incentive to treat. That's also bad news when you're talking about trying to prevent global pandemics. And so solving all of those means changing the incentive structure in healthcare so that we can empower people, A, through having healthcare that doesn't exist behind a paywall, B, making sure that it's not a matter of profit, but a matter of public health as to why we're putting money into our hospitals to expand their capacity and empower them in a moment of a crisis. And that we're not supplying the same way we supply every other business, which is about reducing overhead, but rather supplying to make sure that people have reserve if and when bad things are going to happen. And then lastly, creating the incentive to prevent disease rather than just to cure it. So that's what I'd like to see in healthcare. I think this moment has made those arguments in very explicit terms. That's our responsibility to carry them forward.
Abdul, thank you so much for everything that you're doing and for taking the time to join us during this conversation. I trust we're going to have more of these, so we'll call upon you again to do that. Before we wrap up, Ryan, may I ask you for some final parting words real quick?
Sure. So two things just to tie a couple of threads together. One of the reasons that this election is really important is because the state legislatures that are seated after this election are the ones who are going to be drawing the new maps after the census data is had. So redistricting is really, really important and really determines how our electoral democracy works. So pay attention to those state races as well for that reason. And then lastly, a really quick plug. We just launched the National Arab American Bar Association, and for Arab American Heritage Month, we're doing a sale on memberships, 20% off. It's a really great group. It's really taking off in an amazing way. And it's an important way to get the Arab American legal community together to help push these causes in an effective way.
Thank you, Ryan. Suhair, on Census Day, what do you have for us?
Thanks, Maya. So just quickly, I do want to reemphasize that we do have at 4 p.m. a Twitter storm. If you do not have Twitter and you're like, I don't want to be on there, you can still post on Facebook or on Instagram and use the hashtag YOLACountMeIn so that we can be able to see your posts and amplify it. Again, it's about spreading out the word and getting people to know that they should be filling out their census form. So you can go on YOLACountMeIn.org, or you can find us at 4 p.m. Eastern, 1 p.m. Pacific on Twitter.
Thank you so much to Suhair, Ryan, and Abdul for joining us. Thank you to all of you for taking the time to be with us today. I want to redirect you real quick. AIUSA.org is the website. We maintain all of the information that we presented on there today, there, as well as the YOLACountMeIn.org website, which is available in both Arabic and English for the Arabic speakers. The final point I want to make is this is a conversation that makes me feel empowered at a time like this, because there is so much that we can be doing. And we've given you the reasons for why this is important, both in terms of the voter protection work that has to happen, as well as the Yola Count Me In work around the census. So we're grateful that you're all with us in this fight and we're pushing forward together. The one final point I want to make is regrettably a more difficult one, which is that we also do a great deal of work at the Institute on combating hate crime, specifically work related to hate crime reporting and data collection. And I just want those of us who are all on at this time to remember that our colleagues and friends in the Asian American community are facing some particularly hostile environments right now. So the more work that we can do with those communities at a time like this, in your local neighborhoods and among your neighbors, at your schools, all of that is much needed work. And we're here to help with that and the other work that we've talked about today. So please don't hesitate to reach out to us on any of these things. Thank you, everybody, and have a wonderful day.